Yeah, actually today I thought of talking about stethoscope. This stethoscope is used by medical doctors, physicians. So this is very unique for them. And this is actually the name itself gives some meaning. So that is stethoscope. Stet means chest, scope means examination. So this is used to mainly examine the chest of people, patients, the lungs and the heart. So we can hear a lot of abnormal sounds, normal sounds as well as abnormal sounds. So thereby we can make certain diagnosis of various diseases in the heart as well as in the lungs. If I want to tell you about the history of this stethoscope, in the early 18th century, so there was no such very advanced stethoscope. They had doctors used to go to the patient and lean forward and listen to the patient's chest by their ears and then used to hear the abnormal sounds. So that's the history. So but lately they developed various instruments. They are called stethoscope actually, but they are not as modern as this. So, but in early 1960s, this modern stethoscope came to the picture. So, we use this now every day. For every doctor use this the stethoscope to auscultate or listen to the chest and the heart and find out normal sounds and then any abnormal sounds and to make a diagnosis. So this is the use of this stethoscope actually. When you use stethoscope in for a patient, that will definitely build a relationship, the doctor and patient relationship. And patient make little, doctor could make the patient little confident and little happy that doctor is going to examine the patient and then going to make a diagnosis. And so therefore patient ultimately think that ultimately becomes very happy, and so that will help the patient's illness and help the patient's confidence, improve the patient's confidence, and so therefore this is a very useful thing for a doctor even today. But on the other hand, so now we are in the middle of crisis, health crisis, the corona COVID-19 crisis. So when you use this stethoscope in day-to-day practice, now you have to go to the patient and you have to examine the patient, you have to get near the patient. And so there is a problem. So because when you use this the stethoscope for patients nowadays, we don't know whether they have got the COVID infection or not. So if you don't know about the patient's status, so you just go and examine. So end of the day, you might get the infection, corona infection. So you could contract the infection. It's very, you all know now this corona COVID infection is very transmissible, and so then one can, when you have a close contact with the patient, you can inhale the virus. So even a doctor could contract the virus when you, if you go and examine the patient with the COVID infection. So therefore, actually now, the recently, you must have all heard that one Sri Lankan school boy, the Venura Vijayasekara from Kandy, and he studies in Kandy Trinity College in Sri Lanka, and he has invented the new stethoscopes. It's something very new. So they are actually, you don't need to go to the patients. You can keep away from the patient, but still you can, with this new stethoscope, you can listen to the patient's heart sounds as well as lung sounds and come to certain conclusions. So this is something revolutionary and something very robust to the whole world. And so I'm going to talk to you about that. Yeah, so this is the new invention by Venura Vijayasekara. This is the stethoscope. This is called STETH 19 COVID stethoscope. So actually this has got two pieces. So one piece here with the tube and then one for the auscultation. So with the conventional one, it's all together, but these are two pieces. So basically this piece should go to the patient, and patient by a bystander. So you keep this on the chest wherever you want to auscultate, examine either lungs or the heart, and keep on the patient's chest or the heart or the lungs. And then this piece for the doctor. It's basically for the patient, this piece, the patient. This is for the doctor. And then you listen. And what I could hear is like all the sounds are picked up by this piece and transmitted to this one. And then I can hear that way. Actually, before I came here, I listened to the patient, one patient with the valves narrowing. I could hear it very, very well, better than the conventional stethoscope, very clear. And so therefore now the doctor does not need to go to the patient. Patient is little far away, and so doctor is listening to the patient and making a diagnosis, listen to the lungs, whether the patient has got pneumonia or whether the patient has got any other heart valve issue, hole in the heart, anything. So you could hear all the normal sounds and the abnormal sounds, keeping this piece with the patient and this piece with the doctor, and you can make a diagnosis. Thereby, you would not get, probably, I think, chance of contracting any infectious, not only COVID, not only corona, any other infectious, any other infections, maybe viral or even bacterial. So this is very useful, I think, for medical people, doctors, physicians, even for nurses, to examine, especially the COVID patients during this pandemic. So this is actually the invent of this stethoscope, Venura Vijaysekar, and I'm going to demonstrate, and he will talk to you further about this stethoscope actually and how to use this. So Venura, so this is your invention.
Yes.
So what made you kind of invent this kind of stethoscope?
Actually, during this coronavirus period, the doctor's safety was my main priority. So I thought of what can I do for the doctors, and I came up with the idea how about making a stethoscope virus, and I just got into making it and finally got this product.
Yeah, so that's very great. And being a school young student, I think he had that thought about doctors and health as well. So that's a great idea. And can you demonstrate how to use this?
So that part goes to the doctor.
Yeah.
The patient or...
So I'm the doctor.
Yes.
No, we assume that you are the patient. Yeah. So I'm going to. So we have now social distancing, at least 2 meters, we assume. And so I'm going to. So you're the patient. Sometimes there can be a bystander. So I'll tell the bystander where to keep the chest piece. We call it chest piece, Philip. And so there is a laser pointer there. So I can carefully point it where to keep it. So just I want it on the heart, over the heart. Yeah, just keep it there. Yeah. So now it's keeping, holding. So now the sounds, the heart sound, this heart sounds little faster than normal because it's little excited. And I can hear it so well. The la, da, la, da. Where I can tell you that your heart is perfectly normal. The normal heart sounds, I can't hear any abnormal sounds. So this is, I just can't believe this actually. I have been using the conventional stethoscope for last 20 years from my medical student days, but still I haven't heard these heart sounds, la, da, so clearly before. So it's a very well heard. Yeah, if you really want to know the mechanics and what's going on here actually, so here I think there is this transmissions, not to the sound transmission, not to Bluetooth or even the Wi-Fi. There are some other waves going on that of course he would know and he would tell it later on. And some waves kind of are there in between this piece and that piece, and through them only these sounds being transmitted. So but I can tell you that it's not Bluetooth or Wi-Fi. So this is another invention. So, and finally, I like to ask you, Edward, so what are your plans with this? I know you're a very proud guy, you should not be very proud Sri Lankan. As a schoolboy, you invented this, the whole world, especially during this pandemic. So, what are your plans?
I was hoping to distribute this through the island for every doctor to visit during this corona period. And again, I was hoping to distribute this worldwide so the world will be a safer place from the coronavirus.
Yeah, that's a very great idea again. And thank you very much. And we are very proud of you and for inventing a stethoscope like this for the whole humanity, not for the patients, not for the doctors, the whole humanity. And thank you so much.
I'm very happy to present one of the STETH COVID stethoscopes to Dr.Gotabhaya Ranasinghe.
Thank you, Vero. Thank you very much. And so this is the pack of this stethoscope, very nicely packed, and it's a very user-friendly stethoscope actually. And I like the way it's packed. You can carry it to the ward. So it's I'm going to use this actually. I'm sure it will be very helpful for me. And so thank you ever so much.